RSV is a respiratory virus that can be particularly dangerous to young children, especially babies. Vaccines have been developed to give to mothers in order to protect the babies after birth. GlaxoSmithKline recently did a phase 3 study that showed that it worked for protecting the child, but it also led to premature births, and they had to stop the trial. So let's talk about it. Hey everybody, it's Dr. David. Hope you're having a great day. So I'm a board certified pediatrician. For those who don't know, I've been working with respiratory illnesses in children from as long as I can remember. Being around so many sick kids is why I almost never get sick, because I have immunity from all of them exposing themselves to me. But I've learned a lot about the immune system, as you can imagine, and how to properly take care of children. Now, of course, we find very often when people have good vitamin D and zinc levels that we are very protective against getting severe diseases. But of course, I'm trying to present information for everybody who's out there so that they can get the most information about this news. Now, also, if you like this type of information that I provide here, please become a Patreon member of ours. That really helps support the work that I do. Now, today we are going to be talking about RSV. We're going to talk about why the vaccine during pregnancy was thought to be beneficial and how this trial, compared to placebo, showed that there was a significant increase in premature births. Now, in terms of respiratory syncytial virus, RSV, okay, this is a virus we all do get at some point during our childhood. It's the youngest among us, or sometimes the more, if there's underlying health conditions, it can be really type of thing where people can go into first it often will kind of like start off as just a cold, and a lot of people it's just a cold, okay, but it can cause wheezing, developing into difficulty breathing, shortness of breath, the need for oxygen, could even cause respiratory failure. There have been babies who need to go on breathing machines, ventilators, because this got so significant. And so, especially because it's in young children, this could, they have much smaller airways than adults do, and that's probably the reason why it's more dangerous for them. But it's also because since we all had it as kids, the reason why you rarely see adults getting it. Now, there has been a resurgence in seniors, in older people who may have not been around the virus for many years, even though they had it when they're younger, but maybe a grandparent then gets exposed to their baby, to their grandchild, I should say, and then their immunity is not as strong as it used to be, and then they can catch it. So that is another vulnerable population that's out there. Now, RSV itself is the most common respiratory virus that hospitalizes children. So it is number one in that category. Okay. Now, what is the benefit if there was to be a successful vaccine? Okay. So first of all, what they've been trying to do is come up with a vaccine to give to the mother. Now, the mother, of course, in that case, it would be an artificial immune response to the mother, because obviously we do not catch respiratory viruses through injections. But the antibodies that are made by the mother, that are then passed through the umbilical, through the placenta and through the umbilical cord, those antibodies are naturally produced antibodies, and then the babies themselves, at the time of as a fetus, they are getting those antibodies that are constantly being put into the baby until the moment the cord is cut, and then those antibodies do stick around for months afterwards. But also, if a mother has those antibodies, she's putting it into the breast milk, the secretory IgA that's in breast milk that lines the respiratory tract, etc., the oral cavity, that serves as the first line of defense against the infection. So there is certainly merit to having a baby protected during its most vulnerable period. Now, of course, as I said, vitamin A at the first signs of illness, part of our immune protocol, which I know I've shared before. All of that is super important. And of course, because it typically starts off with as a cold, that's why we always say start the immune protocol on the first signs of illness, because you don't want to wait for someone to be wheezing. You don't know what they have. You don't know if it could be the flu. You don't know if it could be measles to start off with. That's why we say, if you think about it, start the vitamin A, start the protocol right away. Okay, but the sooner, and that's also because the sooner the virus is controlled, the less inflammation, the less of the cytokines. We learned about the cytokine storm during COVID, but the more we can keep the inflammation tapped down, when we are sick, the spasming of our lungs or the snotty nose, that's the inflammation. That's our body responding to the virus. It's not the virus itself. So the less that our body has to respond to it, because it doesn't grow and grow and grow before we get a hold of it, That's why it's helpful for our immune systems to be super strong and ready to handle all of that. Now, in terms of this particular study that we're discussing today, so GlaxoSmithKline, one of the largest vaccine companies in the world, you may not have heard about them since they were not one of the producers of COVID, but certainly in the pediatric world, it's something that we very well know of. It's one of the major players in the vaccine world. So they did what's called a phase 3 trial. So phase 1, phase 2, phase 3. Phase 2 are usually, and phase 1 are like kind of like a proof of concept, and then kind of a smaller study to see if it works. But you need to do larger phase 3 studies, because that's where you're going to potentially catch more side effects, more unusual adverse reactions. Of course, as we saw in COVID, sometimes we didn't see those things until much larger populations were being exposed to it. But of course, if they're able to find a side effect during the phase 3 trial, they can take care of it. They can shut it down. They can do what is necessary. They can go back to the drawing board to figure out what's going on. So in this last phase before the FDA gives its approval, this particular study, it did show that the vaccine, when given to the mother, it did work. Okay. But it did turn out that it was at the expense of having premature labor, which of course brings a whole bevy of other information as well, of complications, I should say. So this vaccine itself, and I won't get into very much of the details, but it's what's called a pre-fusion F protein-based vaccine. So it's not a monoclonal it's not an mRNA vaccine. It's the protein. Okay, and this F fusion, it's a fusion protein. What it does is it's on the virus, and so as it comes into and hits the cell, like our cell membranes, it fuses to that, and then it allows the virus to enter. And then that, of course, causes problems, because one of the things, especially if it's more advanced, and especially if it gets down into the lung tissue, this doesn't happen up above, but in the lung tissue, it can cause also the different the cells themselves to start fusing together and form a syncytia, where there could be a mass of a whole bunch of cells kind of like stuck together, all with many different nuclei in between. But that makes the function of that cell not work well. And of course, if it's in the lungs, that's a problem. Okay, so in this particular study, women were at a 2-to-1 ratio. Twice as many women got this vaccine, and then so 1/3 got the placebo. Okay, and what that they did find is that compared to the placebo, the vaccine was 69% effective in against both getting any form of RSV, but also in the same number for protection against the severe hospitalization, worse types of things. So again, there was no doubt that this did work, but there was a 37% increase in preterm labor. Okay, and so what that actually did is that led to the company. This is just coming out now, interesting. But in February of 2022, the GlaxoSmithKline, they were concerned about this. They shut the study down. They did not keep giving more vaccines. They went back to the drawing table. Okay, but what they did find, so 6.8% of the infants, when the mom was given it, the vaccine itself, not the placebo, 6.8% of them were born preterm. Okay, preterm means 36 weeks and under. And whereas it was 4.9% in the placebo group, so that's where the 37% difference is. But they determined that for every 54 women who of a baby born to a woman who got the vaccine, there was one additional preterm birth. So it's not an uncommon thing there, right? That's pretty significant. Now, the thing is this also. So there's also what's referred to as very preterm, which is between 28 and 32 weeks. There's even extreme preterm, which is less than 28%. Those are really much more serious, much more complications. Even infant survival can be compromised at that level of prematurity. 5.5% of the in the vaccine group were very premature or extremely premature, versus 2.3% in the placebo group, which does of course mean that most of those babies who got the vaccine, they weren't just born preterm, if that was 6.8, but if 5.5% of that was the much more premature, then that's obviously a bigger problem because of the a larger number of the ones in the placebo group, they were premature, but they were more advanced. And when a baby gets to be 34 weeks, 35 weeks, you may be talking about a couple week hospitalization. They're more feeder growers. Their lungs have matured, but a premature baby, that hasn't happened yet. Those are babies who could end up, I've seen premature babies, some of the very extreme premature, be in the hospital for more than a year after they were born. So obviously we don't want to be inducing that. Okay. Now there has been the smaller phase 2 trial did not show this association. So that's why I say, not sometimes, you need to do these larger studies before we can be making assessments as to safety of things, because it came out in the larger study, not the smaller study. Now, interestingly, Pfizer, that's a name we all do know, right? They have a bivalent RSV vaccine that is approved and is recommended by the FDA and that was what more recently was approved. But they restricted use to only can be given to mothers between 32 and 36 weeks. Now, in the study that I was talking about a moment ago, they were giving it at 24 to 36 weeks. So, of course, the earlier that was given, the more likely that you can get a premature baby. If between 32 and 36 weeks, then, of course, the likelihood of having those very premature babies, not as much if you're starting at 32 weeks. So, that's that. And realistically speaking, there's no real reason to give it earlier than that anyway, because, again, the baby's not going to be born for another 6 to 8 weeks. Okay, so what is my take? Of course, with everything, you got to weigh the pros, you got to weigh the cons. This is one on the GlaxoSmithKline. Even if you wanted it, you can't get it. The other one is there. But in this situation, the researchers did determine that the risks outweighed the benefits. Okay. What this does tell me is that I realize that many of us have had our beefs and lack of trust of big pharma. Okay. But, I'm always one who give credit when credit's due. And sometimes the system actually works. And this did work. They caught it. I'm sure they're going to research it. Maybe they'll find out that in larger studies that it wasn't the same thing. Of course, this is just one study, but it was one study that made them act. And that's good that they did. All right, so that's kind of like my take about the whole thing here. Again, please subscribe to this YouTube channel, share it with everybody. Again, hit us up on Patreon, become a member over there where you can get information earlier. We have our education station over there. It's a little different environment that we're really trying to grow a community within that community. So hope you have a great day.